whether the condition could have been diagnosed earlier, I don't know. Because I'd had back problems in the past, I broke my wrist playing football, and this caused me to actually lift a case subsequently, which slipped a disc or prolapsed disc or whatever. So I'd been diagnosed with disc problems for a number of years, which actually obscured the degree to which I had a hip problem. So I could have had an MRI scan earlier, and I could have had an X-ray earlier, all of which would have perhaps saved a couple of years maybe of the pain that I had.
Well, I started with arthritis, mid-40s in my hips, particularly the right hip. Started just nagging pain, etc., and obviously progressed. And I used to go to the doctor in my 50s because it was getting really painful. And they told me I was just too young to have a hip replacement. So I was sent away just with, take ibuprofen or whatever it is and you'll be okay. But it gradually got worse and worse. They still insisted I was too young. When I went to 59, 60 to have a hip replacement, I was still too young. But it was really impacting on my life then. I was in a lot of pain. It restricted my movements, how I could walk. I couldn't sort of go walking with friends or anything like that because I couldn't walk too far. I was limited about what weights I could lift, things like that, because that would impact on your hip as well and the pain. And eventually I went back to the doctor and they referred me to another specialist. And he decided that after looking at x-rays and things like that, that I could have a hip replacement, that I was in a lot of pain because I was on heavy duty painkillers by this time, the ones that you are prescribed, and they were having no effect.
The basic message I was always getting is, you're far too young for a hip replacement. They'll only last 10 years. What are you going to do? And I just kept saying, but I can't carry on living like this. And in the end, I was taking 800 milligrams of ibuprofen 4 times a day. I was on 2 crutches just to be mobile.
As this was my second experience of having an arthritic hip, I knew what to expect. And when I started this clicking hip, and then the pain, which wasn't too severe to start with, but I knew from past experience to go to the doctor immediately, because it can be like this for a little while and then all of a sudden get quite acute. So I went to my doctor's and obviously had the x-rays, and it was diagnosed quite quickly, and I think I had about 6 months wait before I actually went, I had my operation. So
it was very sudden because I'd gone to fetch a grandson home from school and trying to cross the road to catch a bus, I tripped on the road divider and fell. It was sort of triangular divider with my head on that road, my body on the road divider and my feet hanging off on the next road. And I was in great pain, and passers-by were very good, and lots of people stopped, and somebody called the police and somebody called an ambulance. So they took me to the hospital and very quickly diagnosed that, as the ambulance man had suspected, I'd fractured my hip, my right hip. And they said that they would operate the following morning.
I think I was a little bit frightened before I knew what it was, and of course quite shocked and frightened when I first knew I'd have to have hip surgery. I mean, it is quite a frightening thing to think of somebody going inside your body and essentially chopping out a great big joint. I think it would have been good to have had some reassurance at that point.
In terms of more information, or?
Well, in terms of somebody saying, look, it's actually something we can do quite easily in this day and age.
Do you think it would have helped to talk to other people that have been?
Probably, yes.
To make it work as well as it did, I did scrupulously do all the exercises that you have to do, that you're asked to do. And I do like to know why. So when they said, you must do these exercises before the operation, and then when you've had the operation, carry on and do them afterwards. And I said, well, I can see why I'd need to do them afterwards, but why do I need to do them before? Because you're going to cut through those muscles that I'm supposed to be strengthening. And so what's the point? And he said, well, if you do the exercises, you'll improve the blood supply to the muscles so that when I do cut through them, they'll be more inclined to join back together. Whereas if they were flaccid and you hadn't, you know, exercise them, you'd find it, your body would find it more difficult. I mean, I have had lots of operations before, and the anaesthetist, incidentally, the anaesthetist tried to persuade me to have a spinal block. She said, I've had 2, and I said, right, have you got 2 artificial hips? And she said, no, it was for my children. I had spinal blocks to have my children. I said, well, that's quite different to having a new hip, isn't it? And she was trying to say, I've had 2, so you'll be all right having 1. But I said, if I was having difficulty in childbirth, I would certainly have a spinal block. But this isn't the same thing at all. This is a hip replacement, which takes about 3 hours. I don't want to be conscious. I know you don't feel anything, but I don't want to be conscious with all the sawing and the chopping and the banging. Thank you very much. I want a general anaesthetic. Well, it's quite usual these days to have and she tried really hard. And I said, no, I want a general anaesthetic. I do have a choice, and this is my choice.
The pain is immediately different. You wake up and that constant niggling pain that you'd learned to live with, it's just not there anymore. You know, yes, you've got pain, but it's a different pain, and you know it's a pain that will go. And thinking through in hospital, I suppose the worst thing was being dependent on somebody else when you wanted to go to the loo.
Where I think the information was less good, and which only became apparent after the operation, was that there wasn't any information about the way in which the general anaesthetic and the actual operation itself might affect you. So where I think hospitals should think more carefully is that most patients will not have had such a serious operation before, and it's very disorientating when you come round from an anaesthetic, the sort of bizarre ways in which it can affect your body and your body's functions. And I personally would have found it really helpful to have had a bit more information beforehand about the sorts of effects that the operation might have in that sense.
The downside is that I was essentially on, codeine-based painkillers, which I was on before the operation, and it doesn't really touch that type of pain that you experience after, that type of surgery. I was probably that evening, no, it would have been the next day after the operation that it started to subside enough that, you know, I was writhing in tears, and it was just quite a horrendous experience for my husband as well, you know, because it was just unbelievably painful. It's quite hard to describe how, I mean, much worse than the pain I had been in for the years leading up. It was just horrendous. So thankfully, I think it was the next day, maybe in the afternoon or something like that, it started to subside enough.
One of the things they gave me to deal with the anti-nausea actually made me even sicker. It was tramadol, which is apparently related to pethidine. And I kind of feel if they'd asked me before, I mean, they ask you, do you have any allergies? And I know I'm allergic to penicillin. I now know never, ever, ever to have tramadol again, because it upsets me. If they'd said, have you had pethidine, and what effect had pethidine had on you? And after all, lots of women have had pethidine in childbirth. Then I think they might have had a bit of warning that tramadol was not a drug to give me. So the tramadol actually made me really ill, because I was just being terribly sick. I couldn't even keep down water.
They took you to the recovery room, but because it was a spinal, I mean, they very quickly got you up on the ward. And basically, as soon as the spinal wore off, they encouraged you to get to a sitting position and do deep breathing. And again, the procedure was blood pressure and your oxygen intake and output. And so they quickly switch you from using a mask to just the prongs in the nose. As I say, there's a less time in recovery when you have a spinal than a general anesthetic.
And can you remember how you felt when you came around, how your hip felt? Did it feel?
Oh, you know. you know that, and I expected to have post-op discomfort, pain, and they give you medication, and they say never let the pain accumulate to a point where it's severe, to ask for medication before reached a severe point where you had to have medication immediately. And they came around and offered you medication on a regular basis.
Day one for me was a Saturday, and the operation went as I expected. But the following day, the Sunday, physio identified a problem with my right side in that my foot was crooked, my right foot was crooked. And she was proved correct in that, in a sense, the expression went that my hip joint had come out. So they put me back through the theatre, knocked me out again, and in my language, pushed it back again. And the next day, the Monday, the consultant and his team looked at me and, in a sense, say that they were sorry that it had happened, but it had happened. And I think that's a very important lesson, because other guys in the ward were worried about me. But I think you've got to put your trust into these people that are doing the job. And I think that's critically important. The staff were worried, all the medical staff were worried. But at the end of the day, I was in their hands, and I was quite happy and contented.
And also I had to ask, about turning over in bed, and once again the pillow between your legs. One of the male nurses told me about this, and it was absolutely fantastic, because you could keep your legs together and turn over as one and use your other hip to propel you over. So that was very, very good. And in fact, I still use a little pillow now, because I find it easier to sleep with my legs aligned, with both hips having been operated on. So that was good.
Eventually, I did just improve, and I managed the crutches, and I managed the stairs down at the physio, and the occupational therapist came up and prepared me for going home, making sure I'd got everything ready. And one of my worries had been, how am I going to manage? I live by myself. And they talked me through it very well, that I could have the Red Cross service to help me for a couple of weeks, I think it was. And they were on the phone. I could phone them up. So when I did go out, I didn't have any worries about managing because it seemed like they'd prepared me for going out, and I'm quite resourceful and independent, so I didn't mind.
So what was the role of the Red Cross?
They have a voluntary service for doing home help things, and they would come in and hoover the house, or you could give them a list of shopping, wash up for you, or basic things.
Yeah, on crutches. I walked around here, walked around the block 2 or 3 times. Yes, I used to do it every day. And sort of, first time my sister came with me, both times she came with me for a walk, for the first sort of 10 days, 12 days, and then I went out and about as normal for the next 4 weeks. People picked me up and took me out, you know, and I just went about as normal. I used my crutches for 5 weeks I used my crutches, and then I just used a stick just to stable me, make me feel stable. But no, after 2 weeks I led a normal life. The only difference was I couldn't drive, I couldn't carry shopping, and I couldn't do everything on my own, but I could go out, you know.
Actually, something does happen that I'd forgotten about. When you get home, you hit a low spot. I do. And I don't know if it's because you get a lot of attention when you're in hospital, and I think maybe it's just me, but it's something that is quite... you just accept it. Everybody's there. They're doing stuff for you. Food's brought to you. People are checking you. They're asking how you are. Everything is sorted out. You come home and you're sort of in a quiet environment, your familiar environment, and that's fantastic. And then a day or so after that, you just can hit a real low spot. You know, it's just depression, I think. I think it's just the after effect, the whole thing. I think it hits you. So if that happens, go with it. It's going to disappear. It's not the way things are. It might just feel like, oh God, you know, this is just dreadful, but it's temporary. It passes. It might just be me. I imagine that other people don't have that at all. It just depends on people. So, yeah.
I bought this cushion because I'm tall. It's difficult for me, you know, sitting where most chairs, I mean, you go to buses or getting in somebody's car, people say, I'll give you a lift, and I think I'd rather go by bus because it's so low in the car. And I bought this from a website, a thing called Thermarest. It's a sports website, but this has been absolutely wonderful, and I take my cushion with me everywhere I go. And I go to visit a friend if I'm going to sit or anything, because it boosts it up. If you're short, you don't have this problem, but if you're tall like me, this has been wonderful.
I did join a forum, a chat group. Now this was before my hip operation, and it's called The Hippies, I think it was. And yeah, just to chat to other people that have had hip issues. And there was quite a few young, you know, it's from people all over the world. And there was, you know, quite a few young women. So it was nice to just sort of, if I felt like it was good to go and read what they were saying, but also if I felt like I could say something if I wanted to. I don't know if I did, but yeah, so it wasn't really a help group though. It was sort of like a self-help group of people getting together and talking about their experiences.
I would have liked some post-operational support. I don't necessarily want anything. I just wanted to talk to other people, and not just people who'd had terrible problems and after 6 months their hips were still giving them hell and so on, but rather people who'd made good progress and so on. I thought just if there was something either you know, where you could exchange email addresses, or a kind of internet club, or maybe something at the hospital where you could meet even just once in a couple of months and just ask people.
Based on my experience, get it done the sooner the better. Go for physio as soon as you can, work with your physiotherapist. I suppose that's somebody I've not mentioned much throughout the whole experience. The physiotherapist I was with, who was looking after me throughout it all, was excellent. And before I can't remember which one it was. No, before both of them, she made sure that I did exercises pre-surgery that would help me recover better afterwards as well. So I think the physiotherapist, good physiotherapist, is also of great importance when it comes to hip replacements. Work with a physiotherapist as soon as you can. I think that's the key thing, and push for surgery as soon as you can.
One thing I would say is that I suppose it's natural, but young health professionals do sometimes tend to stereotype you. You know, they see an old woman with a Zimmer frame in the hospital, and they kind of think that you go around all the time like that. One young woman said to me, "What do you usually use to get about?" And I was puzzled for a minute, and then I said, "My legs." So she said, "Oh, you don't use a stick or anything?" I said, "No." And I think that is something that they could be careful about. Just because you're in hospital and you've had an accident, it doesn't mean that you're always doddery and going around like that.
My biggest fear is how long is it going to last, this hip replacement? I mean, it used to be 10 years when I had the first one done 17 years ago, but I think it might be 20 now, because they have new, all, you know, different hip joints that they put in there. Maybe a lifetime, I don't know. I'm not sure myself, but I know it's a lot longer than my original one.
And I'm glad I did have them done, although I do know I may have to have them looked at and redone in 10, 15 years' time. But I'm grateful for the 20 years, 15 years, even 10 years of being pain-free and being able to do the things with my daughter and go swimming and go clubbing, walk to work, walk shopping, go walking around the shops, just simple things like that I couldn't do before. And if I've got 10 years of doing that, I'll be grateful, rather than just sort of being in pain and sitting at home and not being able to do what I can and do what I want. So, no, I'm grateful I've had them done.
Well, even very small things were wonderful. Remember, for 9 months I had virtually been in prison. I suddenly realised I could walk up the garden and hang out washing that I'd actually been able to get out of my own washing machine. I realised that there was going to be a springtime, and that although the garden was a total mess, I could plant bulbs. And when the snow came, I didn't venture out on ice, but to stand outside, feel snow and feel rain, and really the absolute miracle of not being in pain all the time. One does get used to pain. one forgets what it can be like to do those simple things.